Shelley Johnstone's career as a nurse didn't start in the classroom.
I was working in the kitchen of a nursing home when I was at university doing something different, and there was a lady called Liz, and she used to come in every Saturday and she would take one of the residents out for a drive. And it turned out that she was a nursing instructor. And I hadn't thought about going into nursing, but I got talking to Liz and she must have seen something in me, and I loved talking to the residents, right? And so she encouraged me to go into nursing.
And she did. The New Zealand native has spent more than 3 decades in the medical field. She's currently a nurse practitioner for Kaiser Permanente, and that's how she met Andrea Farmer's mom.
Mum wasn't particularly interactive, so I had most of the talking I did about Mum's condition and care was through Andrea and her sister Jennifer.
And that bridge of communication became extra important when the pandemic hit.
They couldn't come into the facility really to see Mum. There was a lot of visiting behind glass doors, which was tremendously hard when you've got a patient who can't communicate. It's hard because touch is all you have, and if you can't touch and show them, it was very hard for the family.
Shelley later helped to enroll their mom into hospice care.
As time went by, it seemed like it would be very appropriate to enroll Mom with hospice. And at that time, the facilities were making special allowances for patients who are on hospice that families could visit. So that kind of prompted the decision to move her under hospice care, because then they would be able to come in and see her much more freely.
Mom passed away in March of 2020. But that wouldn't be the last time Shelley worked with the Farmer family.
Her dad and her brother actually made the connection that I was the same person who'd taken care of Mom.
In November of 2021, Andrea's dad was admitted to a care facility for rehabilitation, and Shelley was his nurse.
So it was just, there was an instant bond there, and it was so easy to take care of them. It was really cool. When you see the patient as part of a family unit, not just yours, but their family unit, and you can work together and you can say to the family, well look, the patient's the most important person. It's the most important person to them, it's the most important person to me. It starts you off on the right track, you're all on the same page, you all want the same thing.
Shelley Johnstone, our healthcare hero.